everybody, Dr. Ed Gigliotti here. We're blessed to care for people that come from all over and have a lot of different health ailments. And we have from one end of the spectrum where people come in and they're like, hey, I want to get checked. I don't have any symptoms that I know of, but I saw what happened to my Aunt Debbie. It transformed her life, and she was telling me about over Thanksgiving about it, and it makes so much sense. That brain and that spinal cord control everything. I want to make sure that there's no pressure on that system. And then we have the other end of the spectrum where people are coming in with debilitating health issues. It could be migraines, headaches, neck pain, numbness and tingling down your arms and your hands, seizures, back pain, debilitating back pain, leg weakness, list goes on. And then everybody in the middle who has some things that are affecting them and they want to live life healthier. Okay? When someone starts care, it's just the very beginning. The symptoms, a lot of times, what I want you guys to understand is the end of the neurological circuit. So as chiropractors, and especially upper cervical chiropractors, what we're really focused on is the brain and the spinal cord, okay, which is all housed in the skull and the spinal column, those vertebral levels. There's dozens of vertebrae down your spine, and the spinal cord goes down. Inside that, it's protected, and then the nerve roots split off and supply every cell, tissue, organ with life. Okay, so when people come in with symptoms, we want to help people live better. But as you can understand, knowing what we know, that's the tip of the iceberg for us when it comes to serving you. All function, everything that is running within your body is controlled by that brain and spinal cord. So that's why when we make care plans that are going to be the most impactful on your quality and quantity of life based off of science. So there's different phases of care that people go through as they receive care. The first phase of care is the repair phase. So that generally happens between 0 to 8 months. And the repair phase is exactly what it seems. It's that the tissues, as we start to very gently get these vertebrae in a better position after we've done all the initial testing, it's when we start to get them in a better position, they usually just don't pop right in like that. As you got to understand, there's ligaments that connect each vertebrae in your spine, right? And then there's also tendons that connect the muscles to them. There's a whole bunch of tissues. There's fascia, there's everything. And a lot of times they've been stretched, they've been torn, there's scar tissue. So as you adjust, it just doesn't go one in with one adjustment, generally speaking, okay? It'll go slowly as time goes on. As the week turns to months and you get adjusted gently, it'll go more and more as the tissues heal. Okay, so during the repair phase, what you'll see is ligaments starting to re-strengthen. They're going to be laying down collagen fibers on those tendons also. You're going to have the nervous system, the actual nerves themselves starting to heal. They take a long time. Okay, and for instance, neurons, science says they grow about 1 millimeter a day or about 1 inch a month. Okay, so for nerves to truly regenerate to the capacity they were, sometimes there's limitations to matter on how big the injury was and how long it's been there. But science says it takes anywhere from months to years to truly fully regenerate, okay? But that being said, there's a big reparative process that happens in the first 8 months of care, all right? And with ligaments and tendons, they start getting stronger and they start remodeling and regenerating within 1 to 2 months, where at that point, they're starting to get more to their natural position of what they were. So during this phase, generally, people notice some really significant changes within 2 to 4 months, that they start noticing that their quality of life's improving. Maybe the health conditions they came in with are less intensity or not there, okay? It is so important during this phase to stay consistent with care, because as you can understand, this is just the very beginning. There are some times that we give an adjustment. This has happened multiple times throughout our career. And we give an upper cervical adjustment and people come in the next visit. They're like, I don't know what you did. My migraines that I've struggled with for 10 years, for the first time ever, have not occurred for a week. Am I good? Right? Am I done? Is this all there is to it? And it's we celebrate those wins with you. That is so amazing. But as you can understand, that's just the tip of the iceberg when you think about everything happening under your skin. If there was an MRI pre and post, before and after a week, there would be no significant changes in the tissues healing and regenerating. So that's why it's so important during the repair phase to stay consistent with care. Consistent with care, consistent with care. You'll change. That's how you'll actually get the healing to occur, so you could change from the inside out. Phase 2 is anywhere from 8 months to 18 months, okay? And remember, it's different for everybody depending on how old they are, how big the injury is, how long the injury's been there. Tons of factors that play a role. That's why we give a range. But that's stabilization. So during this phase, what we usually see is people hold their adjustments longer. It takes less adjusting to get a great response from the body. They're more adaptable. They could do more in life, and it doesn't affect them negatively. They can go back to like shoveling snow at like even better than they were a couple years before starting office. They can go back to their sports at like full tilt. They can live life the way they want to. Okay, and they're getting stronger while doing it. They don't get checked as frequently during this time as it stabilizes, because those ligaments, tendons, and fascia are continuing to remodel to their true normal prior to the injury that could have happened months or years earlier before they came in our office. Okay? Phase 3 is wellness. Wellness is amazing. I've been doing this work now for about 10 years. We've been blessed to care for people from back on Monroe Avenue to North Winton Road to now 749 East Henrietta. And each time, parking lot got bigger because we've been blessed to serve so many of your amazing friends and family. But the first people we've ever cared for, there are so many that within that first year of care, we're still caring for. All right? And that's when the miracles happen. You pull the people that have made upper cervical chiropractic care a way of life, because you understand, just like eating healthy, just like exercising, just like drinking water, nerve system activity and flow is a necessity of life. So the longer you keep it, you literally regenerate from the inside out. Every 5 to 7 years, we're a new person with every cell in our body, according to science. Every 5 to 7 years. With children, even that turnover rate's even quicker. Okay? So that's why when you keep that brainstem clear and the vertebral levels get even more in alignment, which you can monitor with advanced imaging, which we've done before. And you can see on how the blood flow testing is improving in our office, your muscle strength's improving, everything. As you can understand, when those health issues, those original health issues you came in are so much more improved or vanished, what I really want you to get excited about, and this is what we think about all the time, is everything that's changed from the inside out. Okay? Those nerves in that spinal cord and that brain are controlling every cell, tissue, organ. They're controlling regeneration of your liver. They're controlling heart function, regeneration of your heart. Everything, your muscles, your bone density is all brainstem regulated and spinal cord and brain regulated. So that's why it's an amazing thing when people get the big idea and they're like, why the heck would I ever want pressure to go back on my brain or on my spinal cord? It makes sense to keep my nervous system clear so I can live life to the fullest. Okay? Because this is what I want you guys to understand here. It's like when you look at the brain and the spinal cord, this is what's happening quadrillions of times a second. Okay? You have about 30 trillion cells in your body controlled by 100 billion neurons in your brain. Okay? And you have quadrillions of signals going back and forth, supplying your brain and your body with everything it needs. When there's an impingement on this area, right, that's when people will come in where the symptoms finally come, right? Many times people come in and they don't have symptoms that we would expect to see, even though they have a significant injury, okay? But when that occurs, it cuts down that life expression throughout your whole body. When you make it a way of life and you keep this clear, you go through repairing to stabilizing to wellness. Wellness is the gold standard. I'm telling you, you go to wellness and that's where like your life has completely changed trajectory from where it was going this way to where it is now. Okay? And where it's going to continue to go. It's like what you give yourself from central nervous system function is the direction you're going to go, which is life expression. So it's really awesome stuff. So love and appreciate you guys. I hope you find this helpful. Let's, in all aspects of our life, go to wellness, right? If it's drinking water, if it's exercising, if it's getting adequate sleep, let's not look at it from just treating symptoms and constantly going like this while our body's going like this with function and physiology. And let's go to wellness where we can transform our life for our present day and our future, for our friends and our family and our career, and live life the way we should. Love and appreciate you guys. Thank you. And we're here to help The 2024 I know is going to be a big year. There's going to be so many people that we're going to be blessed to care for. 2023 was a awesome year of serving people, and you just know we're here for your loved ones and for yourselves. And if you need docs in other areas, we'll do our best to find them, especially in different states and cities and countries. We have a tight network of docs where we can help get them docs if they need it. Thank you.